analyze trends. So as you can see, January there was a spike in February, and then March, April it's gone down. However, this year is not good enough. So if I add 2025, you can see that
By the way, I follow this dashboard every evening on DHA.
Yes.
On DHA. I'm very happy that we're now gathering data on a daily basis.
Yes.
How many mothers get birth? How many mothers did we lose? How many newborns and all that? And I think we are, with this data now, we can be able to interface more and do what you were saying, learn from those who are doing well.
Yes.
To improve on those who are not.
Yes. And
Your Excellency, before we started, the inter-county like the review used to take 3 months. When a mother dies, you review after 3 months. Right now, as a result of the inter-county MPDSR and the council spearheading, we are doing reviews within 24 hours. You cannot review a program.
Yes.
You want to see the next program? Please just move to the next.
The next program, Your Excellency, is the collaboration between the two counties, the two levels of government, and so far, through the intervention and the collaboration between the national government and the county governments, we've been able to mobilize equipments through your intervention for fee-for-service, and up to date, we have 862 equipments installed in 251 counties in 44 facilities. From 44 counties. Why 44 counties? These are the counties that requisitioned the equipments as per the analysis that we did, and what you guided that counties must requisition for the needs. The 3 counties that have not requisitioned is Nyamira, Turkana and Kiambu. So they've not requisitioned, and Kiambu has not actually signed the IPA. So I think Nyamira, we've received. Oh, they've signed. All right, that is very good. Yeah, so far, we have a lab imaging that is including a CT scan and MRI, 174 in the 251 facilities. We have 523 lab equipments. We have 140 assorted theater equipments, and of course 24 dialysis in 9 counties. So if you would want to pick a county to see how many facilities have picked, maybe you can just mention a county. We go straight to that county to see how we've deployed the equipments. You can mention a county, Excellency?
Yeah.
Which? KICC. KICC. So KICC is the highest. You see it's actually on blue, 90. And these are the facilities that have actually gotten the equipment. Just go to the left. All these, 90% of what they requested, they've gotten all the equipments. Then you see, per county, we're able to track at the Council of Governors, the facilities are actually receiving what? And just in case of anything, reagents and the like.
Do you have the value of all the equipment that are?
Yes, we do. Yes.
What is the? Do you have it here or?
No, we don't have it here.
I will want to know
the total value of the investment.
Yeah. Yes.
All right.
Yeah.
We will give it. Okay, Excellency. Thank you very much. We truly appreciate. Asante.
Health financing is everything, Excellency.
Good morning, Your Excellency. How are you, Your Excellency? So we'll be taking you through a journey of SHA in 2 years. And Your Excellency, we are calling it reform measured in lives. Your Excellency, to begin with, we have 32.3 million Kenyans registered. And if we compare with where NHIF was at its best, we had 16.9 million Kenyans at that time, and now we are 32.3 million Kenyans registered. In terms of access, Your Excellency, we have an increase in the number of facilities from 8,667 to 10,713. And then some key impacts that is measured in lives. 2 years of NHIF, we had 227,741 surgeries. And in just 2 years for SHA, Your Excellency, we have been able to facilitate 501,839 surgeries. When you come to renal care, we have 8,831 patients during NHIF time for 2 years. During SHA, we've nearly tripled that to 20,952 beneficiaries. Your Excellency will take you through then what the impact has looked like. In terms of numbers, that's how our registration has changed. 15.5 more million Kenyans are now covered under the Social Health Authority. Your Excellency, the next slide. we have care closer to Kenyans. If you look at our facility density, moving from 8,000 to 10,713 means more Kenyans are accessing more facilities. And if we look at the breakdown, Your Excellency, government facilities are more at 5,959, 4,534 private, and FBOs at 541. The next slide, Your Excellency, tells us about the resources. 178.5 billion paid out in all the funds. You can see the Social Health Insurance Fund has catered for 134 billion, PHC at 23 billion, public officers at 16.9 billion, and ECCIF at 3.5 billion. Your Excellency, when we look at PHC, what does it look like in terms of Kenyans' lives? 9.3 million Kenyans have benefited from primary health care services. That's an increment of close to 27% from NHIF time. When we look at, Your Excellency, deliveries, our mothers, at NHIF at its best, we had 985 million mothers. For SHA, we've paid 1.3 million mothers who've been able to deliver through SHA and paid out 17 billion to those mothers. In the next slide, Your Excellency, cancer patients. During NHIF took care of 29,473 cancer patients. SHA has taken care of 50,000 cancer patients. Next slide. In terms of renal care, again, Your Excellency, we started at 8,831 for NHIF. 20,952 Kenyans have benefited from SHA. Your Excellency, when it comes to surgeries, 501,839 surgeries have taken place paid for by SHA, and Kenyans have benefited from that. Your Excellency, in terms of critical care, NHIF did not cover for ICU. We used to pay 0 in NHIF days. Now SHA is paying 28,000, and 31,975 Kenyans have benefited from ICU services. And Your Excellency, the newly launched ambulance dispatch center, Your Excellency, from the time you launched this ambulance dispatch center, we've had 506 incidences that we've been able to dispatch and reach Kenyans. And we've had 18,534 calls come in the last 2 weeks. Now, Your Excellency, we want to move you to this end, where you come and sit here with volunteer beneficiaries. They want to talk to you. They want to tell you what the experience has been. Your Excellency, that is Margaret, that is Dancent, that is Cindy, and that is Dr. Marion. Your Excellency, our beneficiaries here are volunteers. They want to tell you their story, the good, the bad, the ugly, and the successes of this reform. And we'll start with Margaret, and she's an oncology client, and she'll tell us how her journey has been. And she wants to have a conversation with you. They also have requests of you. Yes.
I'm very well. Thank you. Morning to you. Yeah.
Tell me, Margaret.
Kwa majina naitwa Margaret. Wacha niongee Kiswahili ndio kila mtu asikie. Kwa majina naitwa Margaret Lily. Mwaka jana nilijisikia niko na lump kwa matiti, nikashtuka. Kwa sababu nikajiambia, hizi kansa za matiti zinaanzia na lump. Nitaanzaje? I'm just a housewife. So nikakaa 6 months nikichuna majani tu, nikichemsha, nikikula tu hivi nikiona nitapona. Then nikamuongelesha rafiki yangu mmoja anaitwa Mama DLL, akaniambia, mbona ujisumbue? Ushasikia kuna kitu inaitwa SHA? Nikamwambia, hii SHA hii watu wanasema SHA ifanye kazi. Akaniambia, wacha kusikiza story za watu. Nitakupa 4,000, uende ofisi ya SHA, uende ujiregister, alafu tuone itakusaidia kivipi. Akanipa siku 2, akaniletea 4,000 na M-Pesa, nikaongezea 2,000, nikaenda kwa ofisi ya SHA, nikaenda nikajiregister, na kufika pale niliulizwa tu maswali ya kawaida. Uko na simu gani? Unaishi wapi? Vitu kama hivyo. I think walikuwa wanajaribu kuni evaluate wajue nitalipa ngapi. Nikasemekana naweza lipa 6,000. Nikalipa. Nilivyolipa nikauliza tu saa hiyo hii inaweza kuitumia lini? Nikapata saa hiyo ukienda hospitali utaitumia. Mimi nikalala, kesho yake nikakimbia hospitali. Kufika hospitali nikaulizwa kitu ya kwanza, uko na SHA? Nikamwambia niko na SHA. Wakaangalia wakasema hii SHA itafanya kazi. Nikaingizwa kwa daktari akanipima, nikaambiwa nende nifanyiwe skani. Nikasema sasa mimi sina pesa Sasa hiyo daktari anakuongelesha, unaangalia kwa simu ni contact gani utapigia utafute pesa. Lakini kupelekwa kule scanning, SHA ililipia kila kitu. Nikashtuka kwanza. Unajua mwanzo hii ugonjwa ya kansa inakutia wasiwasi. Hujui utatembea vipi, manake ni sio ugonjwa ati kesho umepona. Lakini sasa vile nilivyoenda hospitali nilivyolipiwa na SHA, nikaanza kupata nguvu. Nikapigia msichana wangu nikamwambia SHA imenilipia. Akasema mama, ukweli? Mbona mimi nasikia SHA ilipiwa watu? Nikamwambia nimelipiwa, hata nimefanywa scanning na nimeambiwa nende nifanywe biopsy. Machozi ya furaha ilinitoka. Mtoto wangu akasema nikikuona jioni kwa nyumba nitafurahi, ndo nijue ni kweli mimi ni mgonjwa kweli. Nimeenda matibabu, nimefanywa hivyo vipimo vyote na SHA ilinilipia. Nikapelekwa chemotherapy. Hata sikukaa, baada ya kuonekana tu sasa ni kansa hii already, daktari akanipeleka kwa chemotherapy. Nikamuza chemotherapy itanicost pesa ngapi? Akaniambia wewe usijali, si uko na SHA na SHA inafanya kazi, SHA itakulipia. Mimi ni mgonjwa wa kweli wa kansa, this is my card. Na hizi ni hizo makaratasi ya SHA walizonilipia. Hizi.
Walikulipia kama pesa ngapi?
Kila session iko na pesa yake. Chemotherapy ilikuwa inalipia around 63,000. Chemotherapy ilikuwa inalipia around 63,000 per session. Na linienda 8 session, sikulipa hata shilingi, zote SHA ilinilipia. Ningeweza kweli mimi? Singeweza. Kutoka chemotherapy almost 11 months, kwa sababu nilianza treatment on October last year, na sasa ikifika October nitakuwa nimemaliza 1 year. Na session zote after chemotherapy nikapelekwa surgery. Nikauliza surgeon itanikosti pesa ngapi? Akaniambia it's going to cost you 182,200. Nikamwambia pesa natoa wapi? Akasema mama, kuna SHA.
Sasa nikuulize, hii pesa yote umelipiwa?
Nimelipiwa na SHA.
Sasa imefika kama shilingi ngapi?
Kwa sababu kwanza ilikuwa ni 550,000, alafu tukaja tukapewa top up ikafika 800. Ikafika 800. Yes. For 550 to 800. Ai, mimi niseme nini sasa? Chemotherapy imenitumia.
On account ya ile 6,000 tu ulilipa.
6,000 tu?
Umelipa ingine?
Hapana.
Ile
Hiyo 6,000 tu niliolipa.
bado inalipa hiyo.
Inanilipia paka leo. 8 sessions 663,000 multiply. Alafu surgery 882,200 plus niko na shindano Herceptin naenda 45. They're supposed to be 18 cycles. So far nimepata 11, kadi ndio hii.
Unapata 11
I mean nimepata 10 on 24th Herceptin. On 24th naenda ya 11th. Sijatumia hata shilingi. Mimi nashangaa mtu akisema SHA ifanye na mimi nimelipiwa hiyo yote.
na wale wanasema SHA ifanye. Wale wanasema SHA ifanye ni watu hawajakuwa wagonjwa. Watu wajaenda hospitali. Wengi wao ni watu wanaongea katika mikutano ya siasa, kwa sababu wanafanya siasa. Lakini watu ambao kama wewe ambao mumeenda hospitali, mmetibiwa, experience yenu ni tofauti kabisa. Hivyo msiwajali wale wanaongea mambo ya siasa, lakini hapa tunaongea mambo ya maisha, mambo ya afya ya wananchi. Na kwa sababu wewe pesa zako 6,000 unalipa, na kwa sababu sisi wote tunalipa, ndio inasaidia sasa, kwa sababu hakuna vile shilingi 6,000 inaweza kuwa shilingi 800. Ni ile pooling, ndio sababu ya ya sisi wote kusemekana tuwe ndani ya SHA. Ndio wewe ukiwa mgonjwa tukusaidie, mwingine akiwa mgonjwa afaidike, mwingine, kwa sababu sisi wote hatuwezi kuwa wagonjwa siku moja, lakini tuweze kusaidia, na hivyo ndivyo dunia nzima inavyofanya mambo kama haya. Nimefurahi sana mambo kusikia ile mambo yanayoenda na wewe, na wewe ndio utatusaidia kuwaeleza wengine ndio wasipotoshwe na maneno ambayo hayana.
Your Excellency, Ruto of Dancers, he is a kidney disease patient. He also has a story that he wants to share with you and that request.
Thank you.
These experiences,
Yes.
I think we do them in the other forum.
Yes, we will also do that.
Yes,
We will.
So that they don't take a lot of time.
That's okay. That's okay.
So sisi tutaonana baadaye.
Yes. Yes.
Pamoja na huyu mrembo wangu.
Yes. She's a beneficiary during NHF and now she's given birth in good time. We'll do it then. Thank you.
Okay, tutamleta huyu mungwana. Hi. How are you, my dear?
Thank you. Yes.
Nilikuwa nimeweka huko alisikia.
Your Excellency, thank you so much, Your Excellency, our President, the Deputy President, Prime Cabinet Secretary, and yeah, so here is KEMSA. KEMSA, we are saying we have to contribute to universal coverage. Our business is to ensure commodity security, so that the Hakuna Dawa syndrome that is in the heads of Kenyans is a thing of the past. So we are very happy to report within the last 3-4 years, we have managed to move from an order fill rate of 40 to 90%, over 90%. Actually, our target, Your Excellency, as we have agreed, is to 100%. So anything in public health over 95% is very good at the moment. So the Hakuna Dawa thing should go away. How did we reach there, Your Excellency? We said when we found KEMSA chasing 3,800 molecules to buy, then we said we really need all this. So we sat with our team and the county pharmacists, and we discovered we just need just about 500 SKUs. So we focused on smart buying on the 500. And again, we asked ourselves, do we need to deal with the old policies where we keep stocks for 6 months? Then we said, no, shrink and grow. Keep stocks for 3 months and then grow. So that magically brought our order fill rate very high. So, Your Excellency, we have very serious visibility. We are not working in the darkness, end-to-end supply chain visibility. So as an example, we can at real time, this is a dashboard, see what our order fill rate is, how many orders we have, like the 984 orders, what is the value, the monetary value, over 500 million for those orders. We're serving about 855 facilities for that order, and in about 35 counties. And then it also tells us how much we have been able to push. The green one shows us we have pushed over 500 million to those facilities. Yes, Your Excellency. Digitization has really helped us because visibility is everything. It will help us to be traceable, to be auditable, to be visible. So actually KEMSA, I can say, is fully paperless. Yeah, at the moment. So the next thing is now to hook into DHA so that we have one national LMIS for the country. So digitization has helped us. Dennis here is able to drill down to the exact facilities. The ones I've said 855.
How have you changed the delivery model? So on one side, you have digitization, helping in getting visibility and, managing dark ends, Now, how has delivery changed? To the facility or to the county stores?
Your Excellency, KEMSA is the only agency that can do doorstep delivery, what we call doorstep. We don't deliver at the county or sub-county. The governors here know we deliver to the facility. To the
how did that change? What changed?
over time, we changed, for some time now, that has been the model. So we don't deposit anything at the county or sub-county. We deliver at the doorstep of the health facility. The time frame. Yes, sir. So, time around. Yeah, order turnaround time is the other thing that we measure, and we've also revolutionized that. By the time you order, and the time it takes for the medicines or products to be at your doorstep, we have changed that. We have asked ourselves, when we came, warehouse was working like a normal office, 8 to 5. We said, is this not a normal office? Can we do a shift system from 7 a.m. to 7 p.m. with the same staff? So some are reporting at 7 and leaving at 4. Some are reporting at 10 and leaving at 7. So that actually improved our efficiency, and our order turnaround time has moved from 24 days to less than 2 weeks for the rural health facilities, from 20 days for hospitals to less than 10 days for hospitals now. Thank you, sir. Thank you, sir.
Facilities. 71 facilities across the country, and that is in 31 counties. We've also been able to serve level 6 hospitals, that is KNH, spinal injury. We are supplying ultrasound, where we are able to do obstetric, abdominal, pelvic, and all body scans.
So how many equipment have you supplied?
We've supplied 71 equipment, Your Excellency.
What is the cost of every equipment?
This is fee for service. So the cost of every equipment is about 3 million, the whole package. Additionally, Your Excellency, we are providing consumables for the entire contract period, and we're also giving refresher training, both clinical and technical, to our service health providers. And now what we've also done...
Who takes care of the maintenance?
Us. Maintenance is on us, Your Excellency.
We provide the
consumables, we provide maintenance, and then we also do training, both clinical and technical.
We only pay for use.
You only pay for use, fee for service.
If we are bigger, tunangoja.
No, you don't wait. We have an uptime of 98%, Your Excellency. So what we've also done to do that, if it is not working, we have no money. Yes. So it is in our best interest and the government's interest that it works. Additionally, Your Excellency, we've also been able to integrate this equipment through the Digital Health Authority with SHA. So now there is no fraud. If a SHA approved patient comes here, in the work list we will get the names of the patient, a scan will be done, and a report is sent back to SHA through DHA, confirming that the equipment has offered service and the service that has been offered. Yes.
Already supplied. Very good.
Your Excellency.
How many CT scans? How many ultrasounds?
Your Excellency, this equipment has been able to offer 217,000 plus scans since inception. Yes, across the country.
And the hospitals are those ones?
Yes, those ones across the country.
How many counties?
31 counties. Yes, 31 counties.
Very good. Hello, how are you?
Your Excellency, Karib. Salama. Safi kabis. Welcome to NESP. I think we have Donald who will take you through the MRI.
Welcome, Your Excellency. I think somebody should take us through all of them in one go.
Okay. So we have MRI.
In how many facilities? We have done 2 facilities now. 2 facilities.
2 facilities, yeah.
On MRI. Linear at Kenyatta National Hospital. And linear at Kenyatta. What about the other?
We have the regular laboratory.
Yeah, laboratory.
Yes, laboratory.
How many facilities?
609 equipments deployed.
Yes.
And you can see the live transmission of all the facilities. 609, yes.
This is what lab equipment?
Lab equipments, yes.
What is the lab equipment? Which are the lab equipment?
We have the hematology machine, we have the biochemistry machine, we have got amino analyzer mix of all the lab equipments in different facilities.
You provide the equipment?
We provide the equipment, we provide the reagents, we provide the consumables.
The consumables?
Yes. And also the training and the servicing and maintenance for the next 7 years.
Yes.
Yes. So then we also have the theater.
Yeah.
Theater also the same. We deployed 96 facilities
for theater.
And currently we're also deploying more, up to 150 by end of this month.
150.
The same arrangements.
What are the equipments for the
We have the anesthetic machine, we have the tables, 9 primary equipments for theatre. Fully fledged theatres. Yes, theatre equipment. On 98 facilities, but by end of this month we will be at 150 facilities. Yes, the same arrangement again, all the services.
All these are the facilities that are...
All this, what we have done is we have integrated all the data, and we created the laboratory information system. So what you can see here is a live test that is being done by the facilities now.
Why is it blinking?
I really think it's because of the power. Just
network, Okay.
Just check him.
How many have you done, for example, Kenyatta National Hospital? How many theatres have you kept?
Kenyatta, we have done 15 theatres. 15. Moi teaching, we have done 9. Jaramogi, we have done 9. And
one theatre, sample is like how much?
Each for one theatre is around 15 million. Yeah, 15 million. Yes, 15 to 20 million because the highest is 20 million. Yes.
8 theatres.
8 theatres for Margaret.
So 8 theatres, you do 10. That's 150 million.
That's 150 million.
Which
yes.
would have,
yes.
Your Excellency,
And
I thought you should know that lady for cancer. It's in her family. Her sister, as we speak right now, is a beneficiary of SHA at Coast General.
How are you? Yes.
Okay.
At the 9 cities country.
Yes.
In different facilities.
In different facilities.
What is the experience?
I think so far the experience we saw is most of the patients who are coming for these services to either Kenyatta have now gone back. Yes, have now gone back. So it has reduced the referrals.
Because of the highway and many accidents. So if you look at the number of farms Kenyatta,
Your Excellency, the game changer here is that it's a 100 price. So they can do more complex procedures. Dialysis.
Yes, how are you? Yes.
So here we have dialysis. So in short, dialysis does the work of a failed kidney. By cleaning the fluid and waste from the blood hours at a time and a couple of times a week. So I'll jump to the numbers. So at the moment we have 24 machines installed. We've scheduled an additional 28 machines to be installed, including an installation being done this week, and we're projected to be at 100 machines by the end of the year. Additionally, we've digitized these machines that allows the Ministry of Health to view this utilization in real time, verifying the services they're paying for. Additionally, also provides analytics to help make better informed decisions.
You need to up your game.
Okay, we will. Thank you.
Good morning, Your Excellency.
Good morning, how are you?
Thank you, sir.
Yes.
This is our awareness stand where you are championing, ensuring that no mother in Kenya dies while giving life and no newborn dies from an preventable death. So these are my team members from maternal health, newborn, and also we have an innovation for our youth to access health through AI innovations done by Kenyans. So I will allow, this is our POCUS. POCUS is a point of care ultrasound. This is very handy and it's using AI system.
The last time we were taking it to how many facilities?
635. This year we will do similar numbers.
635
at 5 facilities. Yes.
Across 21
counties. This year we'll go to 26 counties.
These are the people who are dealing with the Ebola.
Yes.
Yeah, Your Excellency, It's okay. Yeah, so this is the Kenya National Public Health Institute, established by the government as the health security agency, guiding matters of protecting the public against events of public health effects of public health threats, So here we are going to demonstrate the outbreaks that we have been trying to respond to. In this current year, we have been able to respond to rabies, we have responded to chikungunya, we have responded to cholera and anthrax. Currently, we are responding to the dengue fever, which is in Garissa and Wajir. We already had 1,678 cases. We have also been responding to mpox, 1,261 cases already, and measles outbreak that is currently ongoing at 463. As you're aware, Your Excellency, we have Ebola outbreak in DRC, and recently Uganda and France also reported cases. Two, yes. So there were 12, but it's done now. So now. So Kenya has not reported any case, but we have already tested around 196 samples that have come to our lab. Yeah, but all of them are turned negative. Yes, people traveling, others who have come to the hospital and have symptoms of Ebola, but presented to the health facility. And in our history taking, we demonstrated that they had either traveled to Uganda or DRC. We have already screened 420,000 cases and 20,000 people at points of entry. Yeah. All right.
Excellency, how are you? Fine. Your Excellency, Anthony.
Salama sana, Your Excellency. We're going to show you what we have done in digitization. Remember, Your Excellency, one of the main problems we had on UHC is accessibility. And one of the first issues that was there is our public hospitals did not have the digital systems and digital infrastructure to be able to provide services. That's why even under NHIF, they used to get a mere 34% of the money. And therefore, Your Excellency, the first thing we did is provide these tablets to all our public facilities, 6,700 of them. This tablet, Your Excellency, comes with power bank, and Your Excellency, it comes with paid up internet of 10 years. And 10 years, Your Excellency, so that our governors and our public hospitals do not need to pay for any of internet connectivity in that area, Your Excellency. For big hospitals of level 4 to 5 and 6, because they take a lot of data, we're giving them these computers, Your Excellency, 4,500 of them. Yes. There are 6,473 out of 6,700. Few of them, others are still ongoing, Your Excellency. And you can see every county, Your Excellency. In every county, you have each and every how much we have distributed for them.
For each facility.
For each facility and every.
Health center.
Yes, Your Excellency. And you can even see, Your Excellency. You can go as it is now. We are able to see how many are live now, because we also monitor. We do not allow anybody to use this device for any other purpose apart from for health. Your Excellency, the second, as we go that, you can move to the second one. So this is how the coverage looks like, and that is how Safaricom is giving us 2G or 3G or 4G in every of those areas. Your Excellency, the second area was the issue of data centers. Many of our public facilities used to have small data centers. For the first time, Kenya became the first country to have a sovereign cloud. This is where we centrally store the data for all our facilities and all health. And that is what we have done in supporting public facilities, Your Excellency, to be able.
On our sovereign cloud.
Yes. We have go live sovereigns, and they're in 3 key areas in the country, Your Excellency, so that it will never go down. Your Excellency, after giving the infrastructure, we come in to give them the software, because they were also lacking the software. Dr. Mumo is here, and he will take you through what the facilities are able to see now, how many have we done, and he will also take you through, Your Excellency, what exactly they are able to see to be able to make decisions using data.
Your Excellency, welcome. You promised, we delivered. And with this, Your Excellency, 95% of our facilities in Kenya are digitalized. all the way from level 2 to level 6. And you can see, for example, we have the map of Kenya here. This is how the distribution is of all the facilities. The facilities in the counties. So we have digitalized all the counties in 47 counties. Your Excellency, Kenyatta National Hospital is the first facility of its kind in Africa to be fully automated, actually paperless. Because now, even from this week, they are transmitting share claims through the electronic way. So we are proud to see, and this is real live dashboard, Your Excellency, whereby we are seeing the number of patients who are coming, who are admitted on real-time basis, Your Excellency. Your Excellency, also, we can see what is happening in real-time basis at the facilities. The governors here, they can even monitor the health workers, wherever they are, on real-time basis. Yes, Your Excellency?
So you have Danisa County, Longisa, Bomet, Sastika, Poros.
Yes, Your Excellency, yes. And you can see the health workers where they are, Your Excellency. In terms, the names of health, how many, like now we have this one, Hassan, who have seen 29 clients this morning. You can always monitor what is happening in real-time basis. And Your Excellency, you can see the number of clients who have been seen in every facility on a daily basis. So we promised, you promised, and now we have delivered. You can see the number of clients who have been seen through the system. Over close to that million clients have been seen through this. People have been seen through our electronic systems, HMIS, Your Excellency. Yes, and we have actually insurance. And you can see in a month, Your Excellency, we are having more than 4 million clients coming, our patients, to be seen through the electronic platform. So you promised, and now you can see we have delivered as a country. Thank you.
Thank you very much, Momo.
Your Excellency, here. Yes. Sorry. So Your Excellency, the third area is about logistics. How do we ensure our drugs are safe? How do we ensure that we're able to track these drugs? But Dr. Wamisha will take you through, Your Excellency.
So good morning, Your Excellency. This is the new kid on the block in Digital Health Agency. So the starting point when digitalizing health products and technology is to have like a Bible, a dictionary on how we identify health products across the health sector. So what we have is a product catalog, the national product catalog, and that's what you're looking at. Everyone who's prescribing, dispensing, bringing in medicines must read from this product catalog. So for example, like this medicine is particularly there.
We were designing as a package. What were
Yes.
No,
the national.
The benefit. Yeah, yes. Pharmacy benefit package.
Exactly. So from there, we then move to health facilities need to be consuming this particular product catalog, and we are doing that through our Taifa Care Hospital Management Information System. The biggest question, Yes.
What is the connection with KICC?
Exactly. That's what I want to now take us there. So the hospital needs to order medicines from KICC. So it's and those medicines, it needs to first identify what is in the store. So the system has a pharmacy and stores module. So the pharmacist is able to see this is what I have in store. Then they are also able to now requisition to KICC through what we are calling the National Logistic Management Information System. And you can...
That is housed in DHA?
Yes, housed in DHA. So let me take you to the NLMIS. This is a game changer, Your Excellency. Here we are going to onboard manufacturers, distributors. We've already onboarded KICC. KICC, we can see we have 10,609 products. This is real time. We can also see the prices. Today, when a pharmacist wants to buy medicines, they have to call somebody, ask what is happening. So on the NLMIS, we have the marketplace. This is going to be a marketplace. So once the order comes in, then the facility is then able to have a global-like experience. This has not been there. The facility in charge wonders, is the truck arriving? When are the medicines coming? But now with this, they are able to tell where their order is. All this is happening through the National Logistic Management Information System and their audit logs. The last bit that we are working on with PPB.
I'm not sure what is the connection with KICC. KICC seems not to be clear about that. Are they sure?
Yes, we've been working with them. they have onboarded, sir.
And when do people pay some attention to this?
Okay.
I don't think
Okay, the last bit that we are working on with PPB is to uniquely identify the health products. Your Excellency, I have 2 medicines in front of you. One has what we call the global standard, what is used to uniquely identify the product, and that is this. It's a data matrix that has got lots of numbers. Then this one doesn't have. Okay, it just has this barcode. We want all medicines coming to Kenya to have this, and we are working with PPB to ensure that this happens. We are currently in transition period, so we are starting with the ones that already have, but by 1st January anything else coming in here must have this. Then with this,
we are
yes,
of the medicine.
Exactly.
The source,
exactly.
The correct ones.
Exactly.
Traceability.
Exactly. And then, Your Excellency, the connection with the patient. Allow me to show you that. Yes. The last one is on Afya Yangu. Because the patient must be in the story. So on Afya Yangu, this is an app that the patient has in their hand on a phone. And this is actually me who visited a health facility a few days back. I had a headache, I was feeling unwell. I went to a senior health center, and this excited me, Your Excellency, because a few days later, when I went to my Afya Yangu, I actually saw the medicines that I was given. They didn't know that it's Joyce. I was just unwell. So this is where we want to reach. Yeah. When we say everyone has to be on the highway, all the health facilities must be on the highway. The community pharmacies, this is it. Yes.
Eventually get it on their phone that they had been to hospital.
Exactly.
They were attended.
Exactly.
This medicine was given to them, and this amount of money was paid for them.
Exactly.
This claim was lodged on their behalf.
Exactly. And yes. Yes.
The facilities around you.
You can check your doctor. Yes. So citizens have affaired, doctors have doctors.
Your Excellency, final one is, remember we had an issue of big issue of fraud across the areas, and we are using the AI engine, Your Excellency, to manage fraud. I want to give Dawe, Your Excellency, to take you through what we have been able to achieve so far.
Your Excellency, my name is Dawe. Mzuri sana, Your Excellency. Asante. What we have been doing is karibu nimekaribia Joyce. Yes. So what we do is we use big data to detect any anomalies in claims data. We use things to do with patterns detection. If a facility has 10 claims this month, how is it they have 1,000 the following month? And there is no public health emergency. We use things like provider collision. Why is a certain provider just working with certain doctors only? We flag out those cases, duplicate claims patterns. How is a patient in certain facility and the same patient is in another facility in Lamu? So those are the things the AI engine does. We pick up those cases. Previously, we used to do those cases post-payment. Now, SHA does not need to do that. We are able to flag those cases before even payment is done. We flag it off, we review it, we give to SHA for investigations. Currently, we can see the active threats, even as at today. We have Nairobi is not, we are not saying Nairobi is a critical area, it's just the volume of business and transactions they are doing. This is as at today, we have about 45 fraud cases that have been picked up, about 2.5 million, followed by Mombasa and Nakuru. And then we are able to see the active cases as at now. If you allow me, Your Excellency, total active cases ahead of time, before any processing has been done. It's real-time fraud monitoring. Yes. So we don't have to do 18 months later, 1 year later, post-audit and say SHA has paid, yes. We don't need to do that anymore. So that's what the fraud engine is doing. Yes, Your Excellency. The other thing, if you allow me, is we had previously patients waiting at facilities for over 48 hours for an approval. So we've built an AI technology that does our pre-auth any request that comes in less than 1 or 2 minutes. Instead of waiting for 48 hours, it's built on over 28 billion parameters of medical renal zoning data, contextualized for Kenyan clinical guidelines, where we are able to send any request that a procedure needs to be done. The AI is able to adjudicate, pull out all the clinical history for this patient, and actually give an approval or actually give decline. So here is a case we have. We uploaded a case for a patient. The AI is able to give a verdict. In this example, the AI has given a verdict for manual review. So saying that the necessity for this requirement does not meet that surgery. So that SHA needs to get value for its money. So this is the pre-auth AI we have done. Yes.
Patient was supposed to be outpatient, admitted.
Yes. Yes, this engine now, the pre-auth AI that's powered by DHA, should be able to detect and pick out these cases and say this does not warrant any admission, Your Excellency. Thank you, Your Excellency. Thank you. Yes, the other bit is, if you allow me, what the AI now has done, the idea is for us to able to adjudicate these claims and reduce the manual workload we have on the doctors. So far we have reduced the manual workload by 54%, and we have been improving as at yes, Your Excellency.
Everything we have done cannot succeed without this. Yes. We can forget about this. Yes. If there is no technology behind this, you cannot. You cannot. Medicines will be stolen. Everything will just be.
We had 1,860 staff. That came down to 820 of China. That means the rest of those other 1,000, the work is done by the community.
Yes, Your Excellency, I want to echo what the CS's remarks, because we have more much volume of claims actions that we need to do than NHIF, but we have lesser capacity. So this is being enabled by the AI, by technology. Actually, as at August now, we have reduced the manual workload by up to 82%. That needs usually a human to sit at a desk. Yes, by 82%. Yes, where you usually have someone sit at a desk and approve a claims.
So we are only doing 20%?
Yes, we are only doing 20%.
So all that was manual now.
And that is why people they had dedicated staff working for them.
Yes.
You know, a facility pays somebody to just approve their things.
Yes.
Now we remove that familiarity from the process. We let the system do what it needs to do. The final part, Your Excellency, is we are collecting a lot of data on diagnosis. We are able to tell now currently what is the disease burden for Kenya. With the data we are collecting, and for interest, I will just take you to prescription, what Dr. Joyce has mentioned. Currently, there is a lot of work. Yes.
We can use it, you know, for other purposes.
Yes, Your Excellency.
Agree on with certain people to use our data on some understanding.
Yes, Your Excellency.
We have the sovereign cloud, and they have to pay for it.
Yes.
We use our data for free. And no one can do law. Nobody can be able to. You guys are blessed.
Thank you, Your Excellency. Thank you, Your Excellency.
Journey and transformation of Kenya Medical Training College. Your Excellency, Kenya Medical from 72 campuses to 92 campuses and 6 satellite campuses in the last 4 years. Your Excellency, we are in 45 of our 47 counties in the Republic of Kenya. Your Excellency, we've increased the number of curricula in KICC by 28.6%, from 98 curricula to 126 curricula, to address the emerging issues in the health sector. Your Excellency, in 2024, you supported us to employ 620 employees. Majority of them are lecturers. Your Excellency, the student admission has risen by 37.2%, from 24,000 to 33,000, Your Excellency. Your Excellency, the student population has increased by 65% from 54,332 to 89,586. Most of them, yes. Your Excellency, our graduates have increased from 15,915 to 22,776 last year. Your Excellency, this year we are going to graduate 25,000, and we want to invite you, Your Excellency, for that graduation. Yes, sir. Thank you, sir. Your Excellency, you have supported us to have 29,641 students access HELB loan. Your Excellency, we now have 57 of our campuses undergoing construction for student accommodation. Your Excellency, labor mobility has also been a focus that your government is focusing on. And Your Excellency, we have increased mobility of human resources by 185% by moving from 1,000 to 3,095, and we want to move even further by collaborating with foreign governments like Germany. Your Excellency, to support SHA and transformation in healthcare, we have focused on courses that allow us to be more efficient, like health records and health insurance cadres.
So, you have how many campuses?
92 campuses and 6 satellite campuses.
And out of the 92, 57 are benefiting from our affordable housing program.
Yes, sir. Yes, sir.
So we are building hostels.
We are building hostels.
Using the housing levy.
Yes, sir.
What do you tell those who are telling us they want to abolish housing levy?
Sir, Your Excellency, this is one of the best transformation for us, because initially our students used to have challenges getting accommodation. You can imagine a student leaving Mombasa to get admission in Mumias, and without pre-arranged accommodation and without hostels. Yes, sir. And right now it is going to be dignified accommodation for our students. Your Excellency, to support Ewene, we have our programs that focus on reproductive health. And Your Excellency, finally, we are cognitive of the need to support communities where we live. And Your Excellency, we have grown 387,000 trees to support your vision of 15 billion trees. And Your Excellency, we also recognize accidents that happen on our roads, Your Excellency. These ones have been supported by the program up to now. But now, Your Excellency, you have given us 392 million currently to support. What we need is 1.2 billion, but this is able to support us, sir. Yes, sir.
Under the new, when Parliament passes the Tertiary Education Placement and Emphatic Act,
yes, sir.
we're going to cover all the students.
Yes, sir. Thank you so much. That has been the major question for our students. And finally, Your Excellency, we have trained 11,200 border borders on emergency response to support during accidents on our highways.
We had also agreed that we provide you some funding to hire more staff.
Yes, sir. It's in the budget, sir. We have 1.92 billion. 1 billion out of it is for recruitment. 392 million out of it is for HELB, and 580 close to 1,200. Yes, sir. And most of it are going to be teaching staff. Teaching staff. Yes, sir.
Look at the growth of the campuses and the growth of the students from 2022, 24,000 to 33,000. We have a serious issue on teachers. Now, at least we have 1,000 because we are
Our campus is falling. Your Excellency, thank you so much.
I've been following what you guys are doing. Thank you very much. How is tell me a few things.
Thank you. Your Excellency, I'm Dr. Zainab, the CEO. I'm with my chair, Mr. James Wambo.
James, Abari. Very good.
We have our facility 650 bed capacity. We, as you know, we opened our doors in 2019 during COVID.
Yes.
When we transitioned from COVID, we started with cancer care as our premium service. And
It's okay.
okay, and we have so far seen over 127 treated patients, and yes. That is from 2022, not from inception. Yes. I also want to focus on open heart surgeries. Your Excellency, we do at least one open heart surgery every week, and sometimes two. So we have done 259. We have the largest critical care capacity with 69 beds, which are almost always full. Yes, so we provide surgical services, maternal and child health. We've started, we have a fully fledged renal services, but we've started transplant also. Your Excellency, our accident and emergency is a very busy center, and this is where we operationalize ECCIF for Kenyans who come in for emergencies. Yes.
Yes. Will cover 1.2 million.
Yes.
Kenya doesn't need to go.
Yes. Your Excellency, 99% of our patients have share. Yes. 99% of our patients have share. We are redirected almost 20 ambulances every day.
You are telling us
It works. It works. It works. Your Excellency, there are cancer patients who come to me and tell me, Dr. Zainab, you have to make sure they are drugs because I don't have any other option. KU is my option. I can't afford out of pocket. So please make sure I don't miss my drugs. So it works, Chair. Your Excellency. We have operationalized the 922, diverse almost 20 ambulances to us every day. So our accident emergency is active for ECCIF. Yes. Your Excellency, we have all the diagnostic, imaging and laboratory testing that we provide across the radiology and the lab services. And we want to focus our next presentation on cancer because it is our premier services. Please walk with me. I show you the rest a little bit towards that end. Thank you. Thank you.
Of how we've integrated our services.
Hi, how are you? Very good.
Here we have a brief demonstration of how we've integrated our services from the facility to the community as well. And so in the community, of course, we have our CHPs who go around, but even at the facility, if you come, you will have a community desk that registers you if you don't have SHA. And then, of course, you will be referred. This is Ruto. Yeah, and then of course you will be referred to the facility, and this is one live one from Makadara. You can see the number of patients who we've seen today.
How many patients?
Today at Makadara Hospital we've seen 95 patients. Currently. This is a live board, and we have that for at least 110 of our facilities. We are yet to implement for level 5, which we are doing together with DHA from the communities. Yeah, and then we've also increased the number of patients that we have because of other innovations that we do. So we give an aftercare service for our mothers in Riruta. So they have a massage for also the father and the mother as well. Thank you very much.
They get massage.
Very good. Yes.
Excellent. Just wanted to demonstrate to how
how things have improved in terms of the critical care, so that the patients have quality and safe medicine. This is available with our surveillance team. It's in the vehicles and they go around. They go to a chemist, immediately they check and it gives it within 2 minutes the results are available. So we make a decision whether to withdraw the product from the market or not.
Yes.
Yes, sir.
Okay, very good.
Yes, sir. Yes, sir.
The other good thing they've done is that on ML3, the last team are coming next week, September.
Yes.
So by October, Kenya is going to attain ML3. Yes, they have done very good reforms. They have also completely rejected this power importation, which was bringing a lot of counterfeits. So they're not giving license anymore. Very good.
Yes. Then your effort as the chairman of the African Union for manufacturing, a new state of factories are setting. They're in different stages, and I believe after that our import will come down by 30%. Yes, sir.
Very good.
Salama sana.
Yes. You are the one registering the doctors?
Yes, all the doctors, the dentists and the health facilities, including the recent ambulance registration that we've done to enable the critical care part. Yes.
What was that problem we are trying to solve? Because no, we are trying to solve under the new law. Yeah. Under the patient quality and patient safety act. Correct. The facility will be shifted to other authorities.
Correct.
They
Yes,
only
sir.
deal with the professionals.
Professionals. Yes, sir.
Because you see, when you have an incestuous relationship there that does not that undermines.
Yes.
We agree, right?
Yes, we agree.
And,
Yes.
and the bill is in the Senate.
Yes.
We are just pushing that to solve. We are
Yes.
going to lose that facility.
No, but it's okay.
No, we understand. It's in the interest of the public.
Yes.
Yes. All right.
Now our new
MTRH.
Yeah. At
Yeah.
Kiblombe.
Lombe.
Can you
Yes, sir.
explain?
Karibu, Your Excellency. So this is a new MTRH Kiplombe. As you can see, just behind there, this is where we are. This is where the structures are.
Accelerate.
We actually, we're working now, moving to 24 hours. So this is the Medical Technology Center where we have the OPD, the theaters, the inpatient for those short stay, and then those are the inpatient blocks, the 3 of them on these sides, and these are the ancillary support services all across the facility. Just outside there, we're going to have a collaboration with energy so that we have a substation for power, and then we're going to have just on the side here a farewell home and also a chapel for those patients who are going living, visiting.
I'm very unhappy that at the pace.
Yeah, we will force him.
To be 2,000
beds.
How are you?
My name is Dr. Joshua. I'm the acting CEO Jaramogi Odinga Teaching and Referral Hospital, and we want to thank you so much, Your Excellency, for elevating Jaramogi Odinga Teaching and Referral Hospital on behalf of the Western region. We are doing something unique in the Western region as far as sickle cell disease is concerned, and we have the apheresis machine here. We are the only public hospital that is doing it in Kenya, and we are the first one to do it because of the sickle cell burden that we have in the region. So, sickle cell disease. So allow me welcome Dr. Brenda to show you how this. Okay, thank you.
We are talking about 125 years of Kenyatta National Hospital. We started 1901 with 40 beds. 40 beds. From there, we were renamed King George in 1952. Then we moved to, during independence, we were renamed after the founding father of this nation. It's Kenyatta National Hospital. Then we started training for midwives. Today we are doing specialized training for nurses. We also moved the university up to where we are. We want to appreciate you for the signing of the legal notice for the first time for Kenyatta National Hospital since 1987. And then we have moved. We came here, we had His Excellency, the Majesty El Selassie coming here in 1964 at Kenyatta National Hospital.
So now now Kenyatta is established under what?
It's established under legal notice, yes, Your Excellency. Yes. Yes, we have your instructions to make it a bill, yeah, Your Excellency and the Deputy President. Now, these are the nurses of 19... Yes. Nurses of 1950s, 1960s, dresses, and this is the journey with the capes no longer there. Your Excellency, we have the journey of anesthesia machines. We have Keme here. Yes, this what was there. Yeah. Dr. Angwaro, please.
Thank you, Thank you, Your Excellency. This was the original old anesthesia machine. The EMO machine. Then we moved to the universal anesthesia machine in the 1950s, and then in the 2000s the modern sophisticated with a ventilator and patient monitor that enables us to do the specialized surgery like 60 to 75 per day in Kenyatta National Hospital. Thank you, Your Excellency.
On the National Equipment Service, how many, I'm told some of your theaters have been equipped.
Yes, Your Excellency, we have now 32 theaters fully equipped at Kenyatta National Hospital. It has never happened before. 32? Yes, 32, Your Excellency. Yes.
Okay, very good.
Good morning, Your Excellency.
Good morning.
How are you?
Fine.
Welcome. We are representing newborn unit in Kenyatta National Hospital.
Yes.
It's a highly specialized unit where we have specialized neonatal nurses to take care of our babies and even neonatologists. So this is a baby that was born preterm. We actually received this baby from...
was born Brita. He keeps telling us.
We actually received this baby as a referral from Kiambu County, and you know that KNH is the national referral hospital. Yes. So we received this preterm baby at 34 weeks. This baby was born 3 weeks before the time, because ideally they're supposed to come at 37 weeks. So what we do in newborn unit at KNH, we ensure that the baby is kept warm. So you see we have a very specialized resuscitator that is able to take care of this baby. We are giving warm. We are also having a CPAP machine. This is called a CPAP machine that is able to help this baby to breathe because the lungs are immature.
The ward, they raised from the private sector about 400 million, Your Excellency. We are renovating to the standard of a Khan, 10 wards, and we'll bring you on the November.
So good morning. I'm quite good, and you? My name is Michael Mwambi. I'm a clinical engineer at Kenyatta National Hospital.
Your Excellency, I am Melissa Alwach, a clinical engineer at the Kenyatta National Hospital.
And Your Excellency, I'm Dr. Margaret Mwasha, a consultant prosthodontist at the Kenyatta National Hospital.
We mean that we are engineers with now a medical bent, meaning that we started with basic engineering as undergraduate level. No, we had to go abroad for training. Yes.
Your Excellency, we are advancing surgical care and prosthodontic rehabilitation, leveraging AI, digital health, and advanced medical technologies such as this 3D printer that you can see here to offer world-class medical services to our patients, not only transforming their lives, but giving them a hope where there was none.
So, Kenyatta National Hospital is the first and only hospital in sub-Saharan Africa to have an embedded 3D printing point of care system, where when we work, we combine the engineering principles with clinical workflows to improve and optimize patient outcomes and patient care.
He's the one who
Yes, thank you. Yes. Thank you.
Hi.
Laboratory Services. Welcome to National Laboratory Services. This is one of our mobile labs. We have 4. This is where high and dangerous pathogens are detected with the BSL-3. We have some of these labs have been deployed to the border side for the region. Four. We have four. Okay. We have two at the border, Busia and Ruahaga. We have this one here and the international. Whereby also we are using for the detection of the same. So far we have managed to detect, to test 196 samples. Ruahaga we have done 51 and Busia we have done 39. 39 samples. These are because Ebola they are the samples detecting, but they are negative. We have not detected any case. We would like you to see the mobile lab. This is the level 3 to show the readiness of Kenya and the labs on the health security and also how ready we are to detect any disease in the country. Thank you.
Kenya Health Security.